just like we had done with aortic stenosis. Once again, here, it's important that your physiology is solid. A couple things here that I'm going to point out to you that without a doubt, you should not be able to miss. Let's continue here. Let's begin at the first point. You see where it says diastolic blood pressure? So here, we're comparing once again the left ventricular pressure curve to the aortic pressure curve. I want you to notice right off the back, is there any discrepancy? Is there any discrepancy between the left ventricular pressure curve and the aortic pressure curve on your left graph? No, there isn't, because that should be in parallel. Meaning to say, when the left ventricle, picture this, is ejecting blood into the aorta, the pressure between the two chambers, what two chambers? Left ventricle and the aorta, the pressure should be synonymous, should be in parallel, should be in synchrony. And it is, even here. So that's not my issue. This is not aortic stenosis. If you want to go back and take a look at aortic stenosis, there was a huge discrepancy between those two curves. Here we don't see that. So we know it's not aortic stenosis. Next, where is my issue? You tell me, when is the aortic valve supposed to close? You see where it says S2? Right underneath S2 is where that aortic valve is supposed to close. That's the beginning of diastole, is it not? And that is when the aortic valve closes, but it can't. That's my problem, aortic regurg. So right after S2, it's an early diastolic murmur, because that is exactly at the point where the pathology begins. Once you understand that, then we can walk through some of the other important points, such as, well, let's pay attention. You see where it says diastolic blood pressure on your left curve, and I want you to go to the pressure volume loop on your right side. There also it says diastolic blood pressure. I want you to, there are the same exact points physiologically, but the manner in which it's presented is a little bit different. Clinically, it is so important, it is so significant, not a point in which you can just brush off. Is that clear? Why? Let's begin. Well, you see where it says, I want to walk you through the pressure volume loop first, and then I'll take you through the left ventricular pressure curve. So in the pressure volume loop, where it says diastolic blood pressure, what's that vertical line? Isovolumetric contraction. Isovolumetric contraction. The red dash line, A, the loop A is the normal. Not the line, but the red dash curve. That's normal. That's isovolumetric contraction. That's normal. And you're building enough pressure so that you can do what, please? So that you can then eject, open up that aortic valve. Would you tell me what that pressure should be? Take your time. What is that pressure that you're going to develop so that you can open up that aortic valve normally? What is it? Is it 120 or 80? It's 80. Now, take a look at the pressure curve on the left. On the left, you see the top of the left ventricular pressure curve, the top, the tip, the pinnacle? That should be what pressure, please? In physio, you learn that as being 120. What is a pressure in which the aortic valve should open? That should be 80. Now you tell me, close your eyes, 120 over 80. What's 80 mean to you? So even though it's a systolic pressure or a systolic process, that 80 represents actual diastolic blood pressure. Do you see the significance of that now? Now you might have looked at it in physio, but clinically, how important is this? Really important. Okay, now in aortic regurg, how easy is it for you to open up that aortic valve? Really easy. That's why your patient has a bounding pulses. Boom, 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 boom. Can I be any more dramatic? And so therefore, you don't have to reach 80 to open up that aortic valve. Maybe drop down to 60, maybe even 50. So now you tell me, what is the significance of the diastolic blood pressure in both of those curves? Dramatically decreased. I want you to take a look at the pressure volume loop on your right and the B curve. And you see where it says diastolic blood pressure? I want you to compare that point to the normal, which is the red curve, and you have your diastolic blood pressure, which is normally at 80, and you find that to be decreased. Clinically, how important is that? If you ask any cardiologist, aortic regurg, diastolic blood pressure being dramatically decreased is point number one as being the most important diagnostic indicator. What's point number two? When you decrease your diastolic blood pressure so much, then you tell me what pulse pressure equals. Pulse pressure equals your systolic blood pressure minus your diastolic blood pressure, right? And what if your diastolic blood pressure decreases like crazy? What happens to pulse pressure? It increases like crazy. Now that I can't help you with. That's just simple math. When you decrease the diastolic blood pressure like crazy, and in the formula for pulse pressure, your pulse pressure increases. The two most important parameters for aortic regurg is a dramatic decrease in diastolic blood pressure and an increase in pulse pressure. So far so good, I hope. One last little point that I need to bring up. You see where that those green lines in your pressure volume loop, A and B, those green lines represent, you see the beginning of B and A, and that's where your aortic valve should close. In aortic regurg, it doesn't close. If your aortic valve doesn't close, then what happens to isovolumetric relaxation? You see the red dash curve and it's moving down? That's normal isovolumetric relaxation. But in aortic regurg, you don't have it. So on your exam, whatever it may be, understand all they have to give you is a lack or deficiency of your isovolumetric relaxation, and that to you, ladies and gentlemen, is aortic regurg. You understand this physio here? You understand the pathogenesis that I've given you, and I've given you the presentation of your patient. How could you miss a single question? How could you never be embarrassed? In fact, whenever you're attending in a rotation and your cardiologist is asking a question, you're not going to be hiding in the back. You're going to be the individual moving up in the front and confidently telling them what? This is aortic regurg, doc, and this is why. This is why. Here are my differentials. This is what's going on with diastolic blood pressure. This is what's going on with pulse pressure. Are you kidding me? You'll be hoisted on their shoulders and you will be paraded around in your rotation sites. Don't you want that? Of course you do. You've worked too hard not to be that good.